Welcome to the programme. The global death toll from COVID-19 is rapidly approaching 800,000 and new infections continue to rise right the way across Europe. Now, despite efforts to contain the virus, Europe reporting around 26,000 new cases every single day. Now, the epicentre of the pandemic might have shifted over to the Americas, but Europe still accounting for roughly 15% of total global cases. Now, when we're looking at the picture across the continent, you can see here France seeing one of Europe's biggest daily increases with over 4,700 new cases reported on Thursday. That's the country's largest single-day jump since lockdown measures ended in May. Spain has had over 65,000 new cases in the past 2 weeks alone and is the highest 14-day infection rate on the continent. More than a quarter of those new infections have come from the capital, Madrid. And Italy, once the epicentre of the crisis, well, cases there are on the rise once again. 845 reported on Thursday, the highest daily rise in over 3 months. Well, joining me now to discuss these figures is Hans Kluge from the World Health Organization, Director for Europe. Mr. Kluge, we're looking there at the picture across Europe. We're looking at the death toll now globally, nearing 800,000. What do you make of what is happening?
Right. What we see is that in 32 out of 55 state parties and territories, the 14-day incidence rate has increased with more than 10%, but more and more localized. For example, in food processing plants or in schools or social gatherings. The good news is that we are not back in February. In February, the default option was to shut down and to reboot. We have learned a lot what needs to be done since then.
And you were saying yesterday that Europe is in a better position now to deal with this crisis. Can I ask what you mean there? Are you looking ahead to maybe possibly avoiding national lockdowns again?
Absolutely. We're now in a situation where it should be possible to manage active COVID transmission in society and at the same time have a running economy and, very important, a running educational system by doing what we know works. For the governments, it means to increase your testing capacity, your contact tracing capacity. For the people, it means basic hygiene measures like hand washing, cough hygiene, avoiding large gatherings. So basically, we know what works.
Well, and actually, yes, that's what I was going to ask you there, because, of course, this picture, when you're looking at the number of cases, it's a fairly distressing picture. So looking then perhaps at the positives, what is being done right and what should we be focusing on to do more of?
Well, we know that whenever the policy response was prompt and drastic, we saw that the response was effective. However, the virus has shown merciless in situations of partisanship, disinformation and denial.
And just finally, Dr. Kluge, we are obviously now in August. We're looking ahead to the winter, and there's been warnings, of course, of flu season once again. As we're starting to look towards the autumn and the winter, having COVID as well, what is your message to Europe?
The message is to be optimistic. This is going to finish at some moment, but not because of a vaccine. It will finish the day that the people accept to learn to live with the virus, and that day can be tomorrow.
Dr. Hans Kluge joining us there, the Regional Director for Europe from the World Health Organization. Thank you very much.